Okay, thank you very much for the invitation. For me, it's a real pleasure to be here, because not long ago I was there, so it's always good to come back to the university and also to learn from you. As I was presenting, my name is Gregorio Torres. I'm a veterinarian. I work for the OIE, based in Paris. And today I was asked to talk about public health, rabies, but because it's the afternoon and I know it's a little bit hard to pay attention, so I'm going to try to do from the very practical point of view. My goal today is to demonstrate that international organization, we do work together, and we actually got a role to play to control disease using the One Health approach. So I will bring you a couple of examples, and basically my main example is going to be rabies. You can see that little picture was taken in Tanzania a few years ago, and then I will go back to this little guy because it's quite important. But before that, I had a very good experience this morning with your colleague from the master, because I can see quite intersectorial. There was vets, there was people from pharmaceutical industry, so there was quite a few range of people. And I would like to ask how many vets or vet students we got here in the room today. Can you raise your hands? Okay, quite a few. How many human doctor, physician, medical? Okay, it's a few of them, and I assume the rest are doing something else. So as we can see, there is a cross-sectional as well participation here. And now this is the question, just for you to think about all these different topics that I'm sure at some point in your career or in your study you work. Emergency disease, surveillance, transboundary animal disease, zoonosis. That will request an intersectoral approach. And we need to think, we need to ask ourselves if we do really ask our colleagues to help and to work together to solve these little problems. So from the international organization, we did ask that question ourselves, and we said, are we alone in this One Health issue? Are we alone in treating zoonosis? And the answer was no. No, we are not alone. We work together, and the three biggest international organizations, WHO, FAO, and OIE, we do work together on a daily basis. And this is something what we call the tripartite alliance, which is very political, it's very easy to sell, but I will try to explain to you what I mean with that. Well, but before that, I want to introduce this gentleman here. It's Rudolf Virchow. For those who work in zoonosis, I think you might be familiar with it. So back in the early 20th century, he said that between animal and human medicine, there are not dividing lines, and there should not be. So he created the term zoonosis. So almost more than 100 years ago, somebody was thinking, oh, hang on, we need to work together. The vets should not work alone. The physician, the medical, should not work alone. We need to work together. And now we need to ask a question again. Do we really work together? Among these topics I introduced earlier, we should say that 60% of human pathogens are zoonotic. 70% of the emergent disease, that some of them have already been mentioned today, they are zoonotic. And 80% of the agents having a potential biothreat are zoonotic. So the question is, do we really dedicate 60% of our time to work with our colleagues, or are we in a compartment working alone? I know some of you are studying One Health. The reason I'm here is to talk about One Health. But what is One Health? Again, very easy to put in the slides, very easy to write an assessment on it. But what is One Health? So I bring you my definition. This is only my own definition. It doesn't really mean it's right, but this is my definition, which is a collaborative and comprehensive way to address, when relevant, not always, we don't need to work together all the time, just when relevant, animal and public health problems. So definitely when we are working on public health, we should not work alone. And that was the concept. The international organization sit together and they prepare a concept note. It was back in 2010, so only 6 years ago. So it's kind of a revolution. We are part of a new concept that, again, they started 100 years ago, but only 6 years ago, the international organization, the international community sit together to say, hang on, we need to work together, and we need to lead by example. To do what? We need to share responsibilities. We need to prevent animal and public health risk. And this is the only way to do it successful in a sustained manner. So 1 year later, as usually, high-level politicians meet together in Mexico. And they say, okay, this is from the technical point of view, makes sense. Let's see if it can make sense from the political point of view. And they did agree that we need to work together. And we create this tripartite, this One Health approach. I identified 3 main topics to work. As I said, my first slide, there were so many topics. But international community, they said, zoonotic influenza, antimicrobial resistance, and rabies should be a priority to demonstrate that this concept of working together, it's really the right approach. If we are not able to work together, if we cannot demonstrate that One Health approach works for this disease, the One Health approach doesn't work. So now our focus is on these 3 priorities. But how does it work? Okay, this is how that's really work, the One Health approach. Okay, I'm going to give you the example of antimicrobial resistance and rabies. And this is a picture I took 2 weeks ago in Namibia. As you can see in the background, this is a rabies. We organized a big rabies meeting because in north of Namibia, bordered with Angola, it's highly endemic on rabies. And every day there is people dying on rabies. And this is pretty awful. If you really want to know what is rabies, just go to Google, YouTube, and put rabies, and you will see people with the clinical signs of symptoms of rabies, and you will see how tough it is. Well, in that part of the world, every day there is 1 person that died because of rabies. So we went there, following the tripartite organization, and we launched a project to eradicate rabies, to eliminate rabies in that area. But how does it work? Well, again, we like meetings, so we organize big meetings. We travel around the world to organize meetings, to sit down in comfortable chairs, and to discuss what to do. So this is one of the things we are very good doing it, but also implementing in the field as well. So we got an executive coordination meeting. So once a year, WHO, OIE, and FAO meet together and revise the agenda. I brought you the agenda of February 2016, so it was not long ago. Just almost 1 month ago. And the meeting took place in Rome, and we discussed quite a few topics. Among them, we talked about Ebola, Zika, antimicrobial resistance, rabies, and avian influenza. The next meeting will be in Geneva. Again, WHO will be the host there. And the year after, in 2018, it would be in Paris. So we rotate, we sit down, we revise the agenda, and then we take action. Okay, so this is the organization I work for. It's the World Organization for Animal Health. What we do? Okay, it was an organization created in 1924, so long ago. That was even before United Nations. So we got 180 countries, are member countries of the OIE. That means we cover almost every single country that got livestock. They are part of the OIE. And we are divided in 5 main regions to cover the world. And I would like to raise your attention about the numbers. And you see in Africa, 54. So every single country in Africa is part of the OIE. And this is the region that contributes the most to the organization. So we are not Western orientated. We are very much orientated to the number of countries in the region. Okay? And our mandate is to improve animal health and animal welfare worldwide. This is the main mandate of the OIE. As I said, the headquarters is in Paris, so if you come to Paris, you're very welcome to visit the headquarters, which is a very nice building. So here we are. So our mandate, we promote transparency. We do believe if countries are transparent, if we share information, we are going to be better prepared to face outbreaks. If we know what's going on in my neighbor country, I will prepare. So it's all about building trust and sharing data. We promote disease control based on science. The OIE is a small organization in terms of the number of staff, but we are very big in terms of the number of people contributing to the OIE. The way we work is that we work with top experts in the world. The countries contribute to the OIE by sending their expert to provide advice to the OIE. And then, with the latest scientific evidence, we create the rules and we create advice for the countries. And one of our main mandate is to promote safe trade. We are part of the World Trade Organization, and the way we do it is to encourage or to contribute to the economic growth of the country. We understand trade is important. A country will not grow if there is not trade. So we promote trade of animals and products. But we want that this trade is safe. We don't really want to transmit disease through trade. So we establish rules and standards for countries to help establish their own regulation to promote trade. And this is kind of the main tools. The OIE terrestrial animal standards that I bet you have studied in your course at some point. If you haven't seen that, I invite you to go to the website and have a look, and then you will understand better what I mean with standard. So we got two different sets of standards. The one is the terrestrial code, which basically we establish the standard for disease control and safe international trade. Then the second set of standards is the terrestrial manual, which basically we focus in diagnostic and the vaccines. So when you are sending sample to be tested to the lab, we establish which is the test should be done. And when you buy a vaccine from the manufacturer, we establish the standard to ensure that this vaccine is effective. I put here the link just in case you want to look at later stage. So I'll give an example of antimicrobial resistance. This is not my topic, but I brought you a couple of slides because again, this is a priority for the tripartite, and as you know, it's a big concern worldwide. But it's not a new problem. Antimicrobial resistance has been a problem since almost we discovered the penicillin. We need antimicrobial, so we cannot say, okay, let's solve the problem, we don't use antimicrobial. No, it's essential to ensure human health and animal health and welfare, but also for food security. The human, animal, and plant sector, we share responsibility. We are all responsible to address this problem. And what we do with antimicrobial resistance from the OIE point of view? Again, we create a standard to control this antimicrobial resistance. We promote sharing data by establishing a database, international database that countries report which antimicrobial they are using and which problems they are using. Again, we cannot work if we don't have information. It's all about transparency. We increase awareness. Awareness is one of the main tools to address these kind of problems. We provide training, publication. We organize big conference where international community meet together. The first one was in Paris in 2013, and now it's planning probably by the end of 2017, 2019, it's the next one. So you might, in the future, you might be part of this global conference. The OIE got focal points in each of the 180 countries. There is one person responsible to manage the antimicrobial resistance in their country. So we established direct link with the countries. We got a pool of experts, pool of focal points that we work together to address this issue. Again, we support quality veterinary medicines, and we harmonize national authorization, which is, again, a big issue. Sometimes veterinarians, we are blamed to be responsible for the antimicrobial resistance because we use antimicrobial for all animals. But in fact, we think we are part of the solution. We are not the problem. Antimicrobials, we need to use it. It's part of our life. But we need to use it in a good manner. rabies. I think we start discussing rabies. It's a big problem nowadays. My colleague Christopher has already mentioned what is rabies, but for those who are not very familiar, I said that rabies kills one person every 10 minutes. We've been here almost an hour, so you can calculate what's happening in 1 hour. And this is real statistic. This is not statistic to put here on a slide to catch your attention. People died on rabies every day, and especially children, because they are people who play with the dogs. Adults, they don't like to play with dogs, it's children. So the children go to the street after school, they play with the dogs, get scratched, get bitten, and then 1 week later, bang, it's gone, it's died. And it's happening mainly in Africa and in Asia because the conditions. So this is a real problem, it's happening now. And as an animal health professional, myself as a veterinarian, it's kind of embarrassed that nowadays, having the tools, having the vaccines, understanding the epidemiology of the disease, in the 21st century, there is still people dying on rabies. And this is what is happening right now. And it happened in Tanzania, in the picture I showed. That picture was taken 2 months after a big outbreak. This little kid was bringing the dogs, because we organized a big vaccination campaign, because 3 of his best friends died because of rabies. There was 1 rabid dog in a small community in Tanzania, and they killed children. So that's really dramatic. I'm sorry to say that, but it's really dramatic, and we need to solve this problem. Because freedom from dogs-mediated rabies is possible. The only thing we need to do, the only thing they need to do, it's to vaccinate dogs. And it's a public good. I mean, we cannot say, well, it's a problem of certain areas in the world, or small village, or just for the owner of the dogs. No, it's a public good. As international community, we need to work together to eliminate this problem. And the most painful thing is that it's 100% preventable. It's not like probably Ebola, which is much more harder, or any Zika that we discussed, or MERS that we don't really understand. No, rabies is well known. We know almost everything about rabies. We got the tools, and we know it's possible. So it's a matter of doing it. And we got the proof of concept. We have done. International community, NGOs, government, they implement vaccination campaign, and they can demonstrate that in a matter of 2-3 years, they just eliminate rabies and save lives. And because we are working with the OIE, this is kind of the thing of the OIE, protecting animals, preserving our future. This is what we do in the OIE. Well, this is a little bit of, I don't know if you can see, but this is how I think rabies, how can I see rabies using the One Health approach and the big 3 international organization. So we got in the center, in the big circle here, dogs vaccination. This is the main pillar. If you vaccinate your dogs will not get rabies. If he bites you, doesn't matter. It's painful, you might get infected, but you will not die. And the OIE creates standard for rabies control, but also we promote responsible dog ownership. My colleague asked a question about dogs population management, stray dogs. Okay, there is standards. We know we need to control dogs. We know most of them, they are not stray, they are just free-roaming dogs, because there are different ways of having your dogs. You can have your dogs at home, or free-roaming on the street. It's still your dogs, but it's free-roaming. But we need to promote responsible ownership. If this dog is vaccinated, it's completely safe for rabies. So that's not a problem. So this is something we do in the OIE, and we try to target the disease at the animal source. So vaccinating dogs. WHO is responsible to promote, to increase awareness and education on the people. People, they need to understand that if you are bitten by a dog, you need to go to the hospital and try to seek for care. And also we need to promote, or WHO need to promote, having post-exposure prophylaxis, immunoglobulins and vaccines available. It's really sad to go to the hospital in Africa, in Asia, ask for a vaccine for vaccination, and there is not vaccines because they are running out of stock. So it's a public health problem. We are working together, but we need to understand that rabies kill people, kill dogs as well. But the reason why are part of the problem is because we want to protect people. So WHO is leading this program. The OIE is taking care of the dogs vaccination, and our colleagues from FAO are helping in the field countries to implement this vaccination program. So as you can see, we definitely need to work together if we eventually want to manage to eliminate rabies. So if you come with me to Paris, I will say, well, this is what we do on a regular basis. This is my daily work on rabies. We promote tripartite initiative. We got daily communication with WHO and FAO. There is a focal point there, like myself, and we organize and coordinate all the activities in the world related to rabies. From the OIE, we create standards, and we promote and we encourage countries to use the standard. We organize regional meetings. We want people to work together. Different regions that got similar problems. So you say, okay, you sit down, you discuss, and we try to find common solution. So we organize big conference, seminar, political seminar, more technical seminars, but we try to encourage people to sit together and to talk. One of the main problems, well, as I said, the main solution is the vaccination. There is vaccine available, they are not too costly, and they are good. If you put in a dog, the dog is going to be immune, most of them. But sometimes, again, the procurement system is very complex. Sometimes even countries, they got the money, but the process of purchasing or ordering this amount of vaccine, it's hard. Because the order should come from the chief veterinary officer in the country, then go through the Ministry of Health, they might go to the Ministry of Finance, and then Foreign Affairs, and can take years. There was an example in one country in West Africa. They wanted to buy 1 million doses of vaccines, a lot of, because they wanted to share with their neighbor, and they had the money. However, it took so long that they missed 2 vaccination cycles. So there was a huge outbreak of rabies. People died just because they were not quick enough. So the OIE created a vaccine bank for dogs vaccination, which is basically a virtual bank when we can procure, we can deploy vaccine to the countries wherever they need it in a very fast way. So this is one of the contributions. We'll come back later to that. Again, surveillance is very important. If you don't know what's happening in your country, you will not know how big is the problem. So you need to establish a very strong surveillance system to make sure that every single case of rabies are reported. And to do that, you need to have strong veterinary services, also strong human health services. You need to understand how to do surveillance. Could be technical, could be challenging from the technical point of view. So we provide guidelines, and we try to provide expertise by OIE reference center. So all around the world there is expert that they are OIE, they call themselves OIE reference lab, that they can provide help and support to any countries that they need it. So the only thing they need to do is send an email, and this expert, part of their task is to provide technical support to the country. So this is another contribution of the OIE to rabies elimination. For rabies, like I'm doing here, is all about raising awareness. If you know the risk, establish your prevention measure. So we try to increase awareness worldwide. We participate in the World Rabies Day. I don't know if you have heard, but 28th of September, it was created, the World Rabies Day. I know there is World Days of absolutely everything, but in this particular case, countries are encouraged to increase or to run an awareness campaign and activity. They launch big vaccination campaign, they do on television, they go to the Live Left, they organize a contest. So this is kind of an important milestone in the year to increase awareness. And the OIE, along with our tripartite, we contribute to that. And again, we don't really work alone. There is many actors, and we try to be coordinated. It has already been mentioned, the Global Alliance for Rabies Control, World Veterinary Association, World Medical Association, any NGOs. We try to establish like a continuous communication to try to find synergies and catalyze action in the field. The OIE as a standard-setting organization, again, we create standards, specific standards for rabies. And I classified here in vertical, which are directly related to rabies. For instance, chapter 8.13, that will explain you what's rabies, case definition. You know, for the epidemiologist, this is rather important. What do you mean with rabies? What kind of indications these dogs, these animals should have to be called that is rabies? We establish what are the minimum standards for disease control, rabies disease control program. What is a country that is free of rabies? All these kind of provisions are here in this chapter. How to move animals. I don't know if you have the experience to move your dogs from one country to another. There is a passport, there is a vaccine obligation, there is a blood test need to be taken. This is probably French regulation or European regulation, but are based on OIE standards. So everywhere in the world, you want to move your dogs from one place to another, you need to do certain things that is coming here in the chapter 8.13. Chapter 5.11, this is an international certificate where the vet needs to sign to say that this dog is safe for trade or for travel. And then chapter 2.1.13, which is all about vaccine and diagnostic. Which kind of test you have to do it to identify rabies. And then there is other horizontal chapter that they are not only related to rabies, they are important for many other diseases that I call, yes, they are horizontal, but they are extremely relevant for rabies. Like chapter 7.7, we talk about dogs population control. Here, there is guidelines of how to control your dog's population in the country. Promote responsible ownership, how to move animals from one side to another. So here, they give you, it's a long chapter, and it's interesting because it's within the welfare section. So we promote dogs population control, but always taking into consideration the welfare of the animals. Chapter 1.1 is all about notification. Each country have obligation to notify to the OIE any cases of rabies. And of course, chapter 1.4, all about surveillance. And there are some examples. So this is kind of things that we have done in the room, in the office, but there are some examples that really contribute to promote rabies control. Again, with the tripartite, working together with WHO and FAO, last year in the World Rabies Day, 28 September 2015, we launched this document that we call Rationale for Investing in the Global Elimination of Dog-Mediated Human Rabies. The idea of this document is to encourage countries to invest on rabies control. We said, look, rabies control is worth it. You need to put your money there because it's important. You will create an impact. And we gave 4 main rationale why government, international organization, and donors, they should invest on rabies. We said that rabies is a major public health problem affecting the poor. I think I've already mentioned that. It's always in the rural community where there is not money to receive treatment. This is where rabies really have an impact. Rabies is preventable. If you get the immunization, you will not get rabies. But also, it's possible to eliminate rabies by vaccinating your dogs. You got 3 dogs, you vaccinate your dogs, those dogs are not going to be infected. So overall, rabies elimination is feasible. So we gave explanation of each of these points, and also we distribute responsibility among the international community, mainly the international organization. So this document is available in the website, and you can go there, have a look, because I think it's really worth to look at. Another example, this is the vaccine bank I was mentioned earlier. What we want is for countries to have good quality vaccine available. I give you an example. It's happening in Indonesia. Not long ago, there was a huge outbreak So the international community and international donors mobilized a lot of money. We went there, we vaccinated the dogs, and we solved the problem. Job done. There was not more people dying on rabies. Everything was fine. So we come back home, everybody happy. It was a proof of concept. We demonstrate that rabies elimination was possible. But unfortunately, the government started to have economical problems, so they decided to buy cheap vaccines, that they were not good ones. So they spent a huge amount of money in the operation. You think about it, about vaccination campaign is a very challenging, a logistic challenging and expensive activity. But the vaccine itself is the least expensive if you compare with the cost of paying the salaries, transport, needles, cold chain. So it's a shame if you are using a poor quality vaccine. So you need to make sure that the vaccine you are using is a good one, because otherwise it's going to waste your money. And in that case, we ran the vaccination campaign with a poor quality vaccines and then big outbreak of rabies. So waste of time and waste of life. So the vaccine bank, again, as I mentioned earlier, the main objective is to procure high quality vaccines in an easy manner. We don't really want having trouble to purchase. Again, it's very frustrating having the money, and having the team ready, the cars, the ice, the cool box, the awareness campaign, everybody mobilized, and then we don't have vaccines. So with the vaccine bank, we try to avoid that. Economic of scale, because it's an international vaccine bank, what we do is we make a big purchase. So thousands of doses of vaccine. So the vaccine manufacturer get a better price, so we can send vaccine with an economic advantage. And we can buy from different suppliers. This is an international tender, so we open the tender and the vaccine manufacturer apply, and we just buy from them. So it's a kind of easy procurement mechanism. But this is a virtual vaccine bank. There is not any room where we got the vaccine stored there. What we got is an agreement with the vaccine manufacturer, and we said, we're going to buy a certain amount of vaccines in a period of 4 years. The commitment is that they need to produce the vaccine very quick. So we just, in a couple of weeks, we found the vaccine manufacturer, they produce the vaccine for us, and we ship the vaccine from the factory to the airport in the countries that are going to be used. When the vaccine arrives at the airport, it's the country's responsibility to transport and to implement it. But that will, because we are international organization, that will help us or help the country to escape somehow the custom problems. Sometimes exportation, importation could be challenged. So using the vaccine bank, that will kind of solve this problem. Again, it's a multi-donor approach. So different donors put a little bit of money in this vaccine bank and then ended having big amount of vaccine that ready to go to the field to be implemented, to vaccinate dogs, and therefore to save some lives. Again, I put here the link in case you want to have more information about the vaccine bank. I'm happy to answer your question later, but if you want, you can go there and have a look. And this is kind of a premiere, because it's the first time we are going to publish. In December 2015, we organized the first big international conference on rabies, tripartite approach, OIE, WHO, FAO, and the Global Alliance. So we met in Geneva for 2 days to discuss what to do with rabies. We've been working together we know it's clear that it's possible, it's feasible, that we need to work together. So almost 300 people, we meet together in a big room, start discussing rabies. And instead of bringing experts, what we brought to the room was to bring people with experience in their countries. So what they were doing is to explain to us how they succeed, how they fail, and why, to better understand the challenge in the field. As I said, everything is known in rabies, or almost. The tools are there. How to use the tools is the challenge. So we wanted to listen to the user, how they managed to organize big vaccination campaign, if they success, why, or if they fail. So We come out with a global framework for rabies elimination. So the idea is to have an international framework where countries can reflect their control program to eliminate rabies, and we call Stop R. As I said, this document has been released today, so the tripartite, it's doing a press release, probably is already in the website, but we were planning to do today, just by chance, and so today it's publicly, and it's the first time I'm talking in public about this Stop R. And what is Stop R? Stop R stands for sociocultural. We cannot eliminate rabies if we don't really understand the sociocultural context of the country. How we look after dogs in France are completely different than how they do it in Tanzania, in Namibia, in the Philippines. So you need to understand how they kept dogs and why rabies is a problem in the country. Technical. Any given disease control program to eradicate or to eliminate rabies have to have an important technical component. You have to have strong veterinary services, good public health services, and also the people to understand rabies. Operational. This disease control program needs to be well organized. Here is where the One Health approach comes. A program run only by vets will fail. A program running only by physician will fail. We need to work together, and not only vet and doctor. We need to bring social economists, we need to bring probably the police, we might need to bring journalists for communication. So it's a team effort, but need to be well structured. So the operational of the program should be very clear. Political. Again, rabies is very political. Nothing can be achieved if there is not political will. The politicians need to understand that they got a problem in their country. Rabies should be a priority. If they don't understand that rabies is a problem, they will not commit themselves in rabies elimination, and that will not be possible. So having the politician in our side, it's always necessary. And R comes not for rabies, but comes for resources. Again, that costs money. It could be private, could be public, could be private and public, but we need to make sure that there is enough money to implement this program. As I said, the amount of money the international community is spending now in post-exposure prophylaxis is huge. Only with 10% of this amount, we could vaccinate all the dogs and we can eliminate rabies. If we manage to convey this message, rabies can be eliminated. Well, and this is going to be my last slide. I think it's more or less the time. But I want to give you some message to take back home, mainly on public health, on One Health approach. Because I think this is the reason why we are here. As I said, One Health is not new, it's not a new concept. It's an ongoing. We are working on it. As I said, international community, we started in 2010. So it's a concept that will continue. And you might, I'm sure you will be a main players on the implementation of the One Health in your career. The One Health is the answer to health threats at the human-animal ecosystem interface. So this is the right approach. The approach should go from the bottom to the top. The international organization, we got a role to play, but this concept needs to be translated to other authorities and agencies at regional, national, but also at local level. People in the village, the vet in the village, they need to talk to the physician in the village. This is the only way to go. And of course, the OIE, we do play an important role in the implementation of the One Health. And the way we do it is try to lead by example. We assume a role as a leader with our colleagues from FAO and WHO, and this is what we are doing. And my last slide is related to rabies, and it's going to be very simple. Rabies elimination is possible, and now is the time. And this is a poster I brought from Namibia last week. And with that, I thank you for your attention. Thank you.